this computer. Perfect. Hello, everyone. This is Mark Anthony with AI Edge Podcast, the place that brings you the best of the best doctors in their niche and in their area. Uh, Today, we have a guest, Dr. Todd Koppel, MD. Today, we're going to be talking about something that a lot of people don't really understand. They hear the word regenerative medicine. What is regenerative? Well, let's go a little bit deeper than that. What is the role of regenerative medicine for neck and back pain? That's what Dr. Todd's going to be speaking about today. You can also find him at gspmweb.com. That's right, gspmweb.com. Thank you so much, Dr. Todd, for being here.
Mark, thank you so much. Yeah, that's short for Garden State Pain Management. As we were just talking about, better than writing it out long.
Hey, it's all good. Like I said, hey, you're just like the Nike shoe. Just keep it short, sweet, and you know what? Just do it. But yeah, tell us, what, before we get into that topic, tell us a little bit about yourself and how you got into what you're doing, Dr. Todd, and we'll take it from there.
Sure. Um, well, I'm a Cornell grad, and I did my medical school training also at Cornell University Medical College. And I did a residency and then a pain fellowship back at Cornell New York Hospital, Hospital for Special Surgery. And the funny thing is, it was 1996. It was everyone said you should do a fellowship, make yourself better for the job market. It wasn't a great job market for that time, and I did a pain fellowship, not necessarily knowing where it was going to take me, but I've been doing it ever since, and I've been loving it. So it's been
Well,
almost 30 years.
30 years. Okay. Well, the good thing about 30 years is you have experience and you've seen a lot and you know what works and what doesn't. Besides that, how was like when you knew, did you know that you were going to be a doctor, or was it something that just kind of slowly, I'm guessing I'm going to go this direction, or I'm not sure. How did that work?
Um, well, I was good in sciences, and the easy answer to your question is yes. I mean, I was good at science, and even starting college, I felt that I was a bio major, and that seemed to be the direction where I was heading. And so, yeah, it all clicked. It seemed to be from a very young age. That's the
Uh-huh.
direction I was heading, and then I was good at it. And now that I'm doing it, and I love it, so it all the pieces of the puzzle came together.
Man, so 96, is that 96 when you graduated, or how did that work?
Yes, so 96 was when I finished my residency, which was in anesthesiology. And after that, you either decide do you, if you want to do a fellowship to specialty train, or just go out, and start practicing after about 13 years of school, to start out in the real world and, finally doing your thing. But it was actually a bad job market for whatever reason, and so to get more training and to take myself out of the job market, I
Right.
decided to do another year of fellowship. And pain medicine is one of the fellowships that are available, and I got accepted again back at New York Hospital's Hospital Special Surgery, back in my old fort at Cornell, and so I finished that in 97, and I've been out in practice ever since.
Man, that's a good year. Some interesting and good music at the same
I
time.
I can't believe I can't believe the time has passed so quickly.
Yeah, I'm with
Great.
you. I graduated, well, high school in 95, and I'm gonna be 50, and I'm an avid pickleball player. I play like 5, 6 days a week. I need to calm down. And I used to be, number one in tennis in high school, and then I also taught professionally. And now my son plays, and he's an athlete. And I was playing with him yesterday, and it's getting to the point where I'm like, man, it's been 30 years, and I'm watching myself play as it's being recorded. And I'm like, wow, I see that I'm doing things in my head differently. I think I'm doing, and I'm not while I'm watching myself. I'm like, oh my Lord, I'm coming into an old man. I'm like, I don't like it. I didn't sign up for this.
Well, you look good. I actually just turned 60, but I
You
feel
you look
good
great, bro. You look great.
and feel good. Feel
Well,
good. I got many more years ahead.
exactly. Well, speaking of feel good and look good, let's talk about neck and back. Before we get into that, a lot of people use the word and they throw it around regenerative medicine. Oh, regenerative medicine or regen medicine. What we know regen means to make anew or to make stronger or to make
Regenerate.
alive, to regenerate. We know that. But what does it mean in layman's terms in your world, not just our world, because that's what we think.
Sure. Well, I mean, when you think to regenerate new tissue
Right.
or, regenerate
Right.
a substance like a tendon or a muscle. I mean, unfortunately, I like to say, after we hit 30, it's all speaking of age, it's all downhill
Right.
from there.
Right.
And we don't really regenerate. In fact, it's the opposite direction. We start to degenerate after about 30 is like the peak. And but we're living longer, we're living better lives, healthier lives. But unfortunately, the activities and the age and everything, that causes wear and tear on the body and
Degeneration.
degeneration. And so regenerative medicine is where you're trying to use the body's own healing processes to try to regenerate tissue sometimes just to heal the tissue,
Right.
potentially to reverse the aging process. There's a lot of anti-aging stuff going on out there, which I don't really get involved with, but reverse the aging process, heal tissue, regenerate tissue, potentially grow new tissue. So that's there are different components of regenerative medicine that are involved in all of those different aspects.
So speaking of regenerate, so could you regenerate a bone that's bone on bone, or is it pretty much done?
Right. Exactly. One of the things I was thinking of as I was just saying is like knee pain.
Mm,
Very common. The knee joint is a horrible joint. It's basically just two bones that are abutting each other, and there's just soft tissue in between that is cushioning it. And the knee joint is, some people, and again, genetics is another factor which we don't necessarily talk about here, but uh, some people can run their whole lives. I ran one summer and I developed bursitis, and when I was in my 20s, and so I had to give that up.
wow.
And so I don't have great knees. I don't have that. They're not bad. I've actually done some treatments on myself, but some people can do it their whole lives. But some regenerative products potentially uh, can help the knee joint heal, and again, potentially regenerate. We're talking about the meniscus, which is part of the cushioning structure of the knee,
Mm.
potentially using the body's own healing process to heal a meniscal tear, potentially regenerate it, and possibly grow
Hmm. So when you say
tissue.
use your own body, what does that really mean? Are you talking about
Yes.
using its blood, using its fat? How does that work?
Right. So, um, the the two areas that people may know about, it's one is platelet-rich plasma.
Mhm.
So that's the most common thing. You take your blood and you centrifuge it and you concentrate the platelets, and then you can inject it back. And there have been some studies, not a ton, but studies cost a lot to do, but and there's really no money necessarily to be made by a company. People are using their own
Mhm.
blood product, and you inject it into. You basically centrifuge the blood. It's very easy. You can do it in the office in about 30 minutes, and inject it back into the body. So that could be in the shoulder, in the knee, in a tendon, in a ligament, and in the back. So that's kind of like the low end of regenerative
Okay.
medicine.
Okay.
And,
So can you go expound a little bit on that? Like, so you get the blood and what do you guys do with it? You shake it in a bottle. It activates the blood. Talk to me. What's the
um,
process?
right. So you take the blood and you have to centrifuge it. And so, when you centrifuge it, the blood products uh, pool depending on their weight. And, we know where the platelets are. Uh, so we take the platelet out of the centrifugation tube and usually we concentrate it once or twice. So the average person has about 250,000 platelets per ml. So if you get like a 50 or or 100 ml uh, centrifuge tube, so you're concentrating it 50 times.
Mm,
So you're talking about several million platelets that you can get, and and then you can inject it back again. Platelets have growth factors, and
okay.
they don't really regenerate new tissue necessarily, but they have growth factors and they have healing factors. And the big thing that platelets have been shown to help with is tendinopathy. So golfer's elbow, runner's knee, where it's more of a tendinopathy, inflammatory condition.
Okay.
Platelets can be the body's own natural way of helping to reduce that injury.
Okay. So what if I have tennis elbow or pickleball elbow? Would that help?
Yes, absolutely. So, you know, with all these things, you want to start with a conservative program. If
Mhm.
the pain, you don't do it if you injure yourself like that week. You want to uh, go through a conservative program, maybe a month of physical therapy. Ultimately, if it's not getting better in a few months, get an MRI. And if you document, and of course, you want to make sure that, obviously, some things it's not indicated for. If you ruptured a tendon
Okay.
or something else, some people come in and they have a shoulder tear. They have like a partial or a full thickness tear of a, let's say, in the shoulder supraspinatus tendon. Um, it's not indicated for that. You don't want to promise the world. That's the one of the big thing about regenerative medicine is sometimes I feel that some
Mm,
practices out there are vying on people's desperation. That for more complex things, not necessarily this, but there are unfortunately clinics out there. People are desperate. There's really no treatment with conventional medicine that can help them. So sometimes I turn patients away. Well, you have full thickness tear. People are trying to obviously avoid surgery,
yeah.
um, but sometimes you can't. So you don't want to promise the world. But
When are times you can't, of meaning you can't avoid it? Like,
well, shoulder's a good example. If you have a
okay.
full thickness tear of one of the shoulder tendons in the rotator cuff, and for example, there might be some retraction. So that means the tissues are actually apart. Um, they have to be sewn back together.
Okay.
There's no way of avoiding that. But
Okay.
if you have, I like to explain tendinopathy is kind of like a rope that's gotten worn. So if you think about it, the tendons in the knee, elbow, shoulder, and it could be other joints, ankle, for example. The tendons, if you have tendinopathy, the rope, the tendon has gotten worn. It might be fraying. That's a very good indication for platelet plasma.
Okay. One of the things that I agree with you 100%. People say sometimes they over deliver and it gets people's expectations too high. I like the way that you kind of come at it. Now, just I'm sure you know this, but So I played an avid pickleball player, but I'll tell you what, you might want to start going out playing some pickleball because 70, I'm not joking with these numbers. 70% of the people that are playing pickleball are in pain and they're playing in pain and they don't want to stop. And you and I know that if you continue to play in pain, you can make it worse, you know? So is that true or that you
Um,
could make it worse?
it is true. I mean, it depends on what the condition is, but my son is a baseball player, and unfortunately, uh, and he's a pitcher. He has a good arm, but he's had shoulder issues.
Hmm.
Uh, he's still growing. He had baseball shoulder with a growth plate injury a few years ago. That, thank God, went away. And he actually had, like, we could talk about. There's a treatment that a friend of mine did for him, which I've started also. It's called shockwave
I love
therapy
shockwave.
that he actually had, and it cured his shoulder pain at that point. Now he kind of has a little bit of an inflammatory condition, bursitis. So we told him you have to take a break for the summer. He really wanted to be on his summer league,
Right.
but you have to take a break. If the inflammatory condition persists and you keep aggravating it with overuse injury, then you don't let it heal.
Mhm.
Um, if you don't let the bursitis resolve completely or the inflammatory condition resolve completely, then, as you said, it's just going to get worse. It doesn't have a chance to heal, and the inflammation causes tissues to wear down. You get toxins in the local environment there, and that causes swelling and edema of the tissues. And with continued overuse, those tissues are going to wear quicker. So, as you said, if you have pain and you're playing in pain, rest and maybe some physical therapy is the most important thing to do right away, and see if it'll go away with, as we said, with more conservative measures before you start getting into any kind of interventional thing.
So tissue can regenerate or just is that
Well,
correct? Am I saying that correct? Or can it heal if you let it heal while you're doing, say, like more of a, you know, regenerating the blood, would that make it allow it to heal or does
well,
that
so
regenerate or how does that work?
right. So we were talking about PRP, as it's called, platelet-rich plasma.
Mhm.
And then the other modality is to take a person's own stem cells. So you can take someone's stem cells. My The usual area that I go is in the bone marrow in the hip, in the
Okay.
iliac. So
That's really
you,
good.
you take a patient's own stem cells, and stem cells again potentially um, can help regenerate tissue. I like to coin it. I tell patients PRP is your low test gasoline,
Right.
and stem cells is your high test gasoline. Low test gasoline, gasoline gets you from A to B, it works, but maybe if you use high test, it's it'll do it more efficiently, it'll do a better job, and of course, there's a different price point involved.
Oh yeah.
Uh,
Well, you've got your regular gas and you got your higher gas. There's different
exactly.
levels.
So stem cells are more the high test. Um, so their cells, again, potentially, it cells can these are cells that can become any other cell in the body. And so the theory is that if you inject it into an area, that potentially it can grow more of that same tissue, and yes, regenerate some of that tissue.
Interesting. So how would you help somebody that with regenerative medicine has a really bad neck problem and they've been having a really bad neck issue for years? And you and I know that neck is probably a very, at least it's my opinion. I'm not a doctor, but very, it could be. It seems very complicated because you're dealing with the neck. It's
Right.
it's right on the mouth of God. That's what I call it. That little spot right there that keeps the bobblehead up and going.
Well, like for your example, that you said you had back pain from a herniation.
Yep.
One thing is that we know that people have things that may not be causing the pain. An MRI, you have to realize an MRI is a computer generated image. It's not an actual picture. And I've been I've seen studies where depending on how the MRI is calibrated and all, um, and they've tested this on with patients that it can show things that it can be wrong. I mean, every test has a false positive and a false negative test. Now, you said you had a disc herniation.
Yep.
Um, it's possible that that herniation could have resolved with the therapy that you had, or potentially it was more of a mechanical type pain from a different structure that the chiropractor treated.
You're right.
Now, a very old study from the 1980s, they did an MRI on 100 asymptomatic patients who never had a history of back pain. And it showed 40 or 50% had some spinal changes, whether it was a bulge or even some
Okay.
people had a herniation that was completely asymptomatic, that wasn't
Wow.
causing. I'll throw this at you at a different angle. If you do an MRI study, let's say you do an MRI on 100 people who are 70 years of age, almost 0% of those people will have a normal MRI. And you're 70 years of age. You had 70 years of degeneration. Maybe they'll find some I hate to use the word arthritis, but some arthritic changes, some collapse of the bone, some degenerative changes. I like to say it's normal to be abnormal. Everyone's going to have an abnormal finding,
Right.
and the art of the practice is to find out, well, what is really causing the pain, and that's where interventional pain treatments that I do uh, are very useful. Um, I use the tools of my trade to, the first thing you have to do before you get started with regenerative treatments is to figure out where the pain is coming from.
Bingo.
I have a little prop here that I can show you. So, you know, the big thing that everyone talks about are the discs. Everyone knows, most people know what a disc herniation is. So this is the normal disc, and this is when it's herniated. The disc pushes out and it can press on the nerves. Um, but there's a lot more structures involved. Um, in the back of the spine are these joints here, and that's called the facet joint. And in my field, we all know that these joint changes uh, can many times, even 50% of the time, it could be this structure and not the disc that's causing the pain. And then, of course, you have a lot of supporting structures. You have muscles, nerves, ligaments here. They're holding all together. So um, you have to figure out, once you figure out where the pain is coming from, then if it's indicated, you could discuss a regenerative treatment. So but
Okay.
getting back, let's say you ultimately decide someone has a maybe a disc herniation or some collapse of a disc in their neck or back that's causing pain, and it could warrant a regenerative treatment,
Hmm.
where you take the patient's own body products, whether it be a PRP, platelets, or stem cells, and you could inject it. Around, not into the nerve, but around the nerve to help bathe the nerve. PRP has been shown to be very good at reducing nerve inflammation. So a lot of people have been injecting PRP into around the nerve root. It's called the neuroframe in there.
Hmm.
Or you, if you're trying to heal the disc, you could inject it into the disc itself.
Hmm.
PRP or potentially stem cells, and I've had some good results with that. So you inject it in. There was actually one study in the lower back that they injected, and then they did an MRI. When someone has degeneration on the MRI, the discs look very dusky, so they become very, very dark. That's usually in the lower two levels of the
Right.
spine. The L45 and the L5S1. They did a study that they showed 6 months later there was actually, it lightened up. So it appeared that the disc got more hydrated and potentially it seems like it actually grew new nucleus material after the injection of one of the products into. When I say products, I mean the uh, patient's own cells into their disc. So that was very exciting. And there are some studies, again, studies are expensive and it's hard to do. So, but there are some studies being done, and but it's very exciting.
My question to you is why are not maybe they are. Okay, so I call the big there you've got the big box doctors, where we need them. They're great, if I'm about to lose a limb, they're going to help me out, you know what I mean? But just regular hospitals. Why don't a lot of hospitals use stem cells and PRP or you don't hear a lot about it? Maybe they do. I don't know. I don't really hear about, the big hospitals using stem cells and stuff like that. I'm just curious.
Um, some are, and I've actually I do some invasive procedures and do like a minimally invasive disc procedure. And in some of the hospitals that I work now, we've done just that. We
Oh, wow.
we draw the patient's stem cells, and after we do a little uh, percutaneous discectomy, I like to call it, I've injected stem cells into the patient's disc. And I actually have some videos on my YouTube channel that patients discussing their relief after these procedures, and but it hasn't caught on again as much as in the mainstream insurance and hospitals and everything. And I mean that's the big thing, maybe in 20 or 50 years it'll be different,
I think it
but
will.
for now, um, these aren't unfortunately these aren't any procedures that an insurance company will cover. They consider it experimental. There has to be a lot more studies done, and again, there are some being done, but not a ton.
Right.
So, they want more studies, as opposed to like a cortisone injection. They are a little bit more costly. So, I'm sure from an insurance point of view, that's going to be a stumbling block to get that covered. But uh, some insurance companies are understanding now that um, patients' general health, weight management, and exercise, and maintenance, and that sort of thing, will by paying for some things sooner that will prevent things down the road in 50 years for people to have all the chronic diseases that we have, diabetes and heart disease and other things. And it's certainly possible that some of these regenerative products will have a role in that in the future. Um, but some have caught on that it's better to keep people maintained and healthy than to deal with their sicknesses later on. But again, it's also a societal mentality. It seems, in the United States, it seems that we're seem to be like a quick fix society. You know, uh, we want to eat McDonald's for 20 years, and then when our cholesterol's high,
Yeah. We want to
uh,
change.
just go to a doctor and think that 20 or 30 years of bad living can cure them right away. And unfortunately, it can't. So
Right.
it takes a role of everything, insurance companies, but also the general societal uh, mentality that people have to be responsible for their own health.
100%. I mean, it doesn't help. I'm not a big pharma fan. It doesn't help when you see all these commercials. They're spending millions and millions of dollars to push patches. What I mean by that is if you have diabetes, don't worry about it. We've got a pill for that. And it shows everybody all happy, right? Then at the end, you see real fast, don't worry, but this could cause diarrhea or your heart might fall out in 2 minutes. That's kind of a joke. I'm just using it as an
Yeah,
example. I can say that because I'm not a doctor, so I like that. So I think that it's a bunch of bull crap that they're feeding the
Mm.
public because that's their McDonald's. The big pharma has become the McDonald's. A quick get, just take a needle, take a patch, right? And guess what? It makes them feel good for a little bit. Then all of a sudden, wait, why does my arm feel like it's going to fall off and my heart's beating 1,000 miles an hour? And that's why people out there in internet land, you need people like Dr. Todd. You want somebody that can help you, that's going to not just give you a shot, right? But he's going to focus on, let's look at the whole body. He's a whole body doctor. Let's look at where's the root coming from. If I'm wrong, please correct me while I talk. Let's look at the root. Let's see how we can, if we can't heal you, let's see how we can get you to feel better without having these symptoms where it's like a commercial at the end. You might have diarrhea at the end, or you might have a heart
It,
palpitation, blah, blah, blah. I mean, it's to help,
I'm,
to live better.
yeah, I mean,
That's my opinion. I'm not putting words in your mouth.
right,
I hope
right.
not. I
No,
hope
I
not.
mean, I'm not. Medicines are important,
Oh, yeah.
um, and there's some people that absolutely need it.
100%.
Um, I'm just saying that just the general mentality in this country, just to, people have to be responsible for their own health, to diet and exercise and this and that. And I think there's been
Little
uh,
shift.
some shift exactly
I agree. So
now,
there's
but
a lot of positive.
you know, but again, regenerative medicine can. I mean, we'll see where it takes us in the future. But as I said, there are some doctors that are doing longevity medicine and overall health, and in part they're utilizing some of these regenerative aspects, and it's not a bad thing. Unfortunately, again, it's not something that's covered by the insurances. So, but that's one aspect that people are taking control of their own health, and that's very important. But
I'll tell you why it's not pushed. I'll tell you why. And this is my opinion, of course. It's not pushed because it works. It's not pushed because there's a lot of money to be made. If there's a lot of money to be made, they're going to push it. But think about it. Why would we? And I'm just going to keep it real here. Okay, we're going to do a little Joe Rogan here. Why would you want to heal a whole bunch of people? I'm not talking about you. There's no money in it, and so I know
well,
I'm hitting on a touchy subject, and this is again just
yeah,
my opinion. There's no money in it. If you look at big pharma, billions. I mean, we've been doing it. We're supposed to help
right,
people.
right.
I'm not saying they don't. I'm not saying they don't. I want you to hear that. I'm not saying they don't. What I'm saying is when you know that something is working, you're going to see it in certain places like video games. I'm going somewhere with this. Video games. I was playing a video game the other day with my son, a military game, and I was literally almost dead. If I got shot one more time in the leg, I would have been dead. And then all of a sudden, I pushed a certain button. I didn't know what the heck I was doing. And my character popped out in a syringe and stuck himself. And all of a sudden, I got all this energy. I'm like, what the heck? And I go to my son, what is that? He goes, oh, dad, you just put a stem cell shot in you. Hold on. Hold on. What I'm trying to tell you is I believe that we're on the cusp for regenerative medicine in a way that we've never seen. And that's why I'm glad to have people like you that are on the cutting edge, and it's going to happen, I believe. I mean, if you start seeing it in video games and you have a little kid telling
That's
you,
hysterical.
that just kind of says a lot of where we're going because technology is moving so quick. People are more health conscious. People are living longer, just like you said. People are doing the research. You have people like Joe Rogan who's pushing stem cells, PRP, because it works. You got Mel Gibson, whose father was going to die, wasn't going to live. They told him, go talk to your dad, kiss him goodbye. But he knew that someone said, hey, you could probably do stem cells, but you can't do it here in the United States. This was years ago. And then all of a sudden, the guy's still alive. It saved his life. Now, I'm not saying that happens for everybody. Every person's different. Anyways, I had to throw that out there. What are your thoughts on
Sure.
what I just said, if you don't mind me asking?
Well, again, there are a lot of uh, doctors out there that are doing some regenerative medicine and longevity and everything, and but still, you can't. And I think it's fascinating. I think it's exciting, and certainly it'll play a role. If, as we're saying, the tide is shifting a little bit now. People are more responsible for their own health, and again, you got to know that it takes 30 years for certain environmental factors and what you eat and exercise to get to a point where you are. So even regenerative medicine, to some extent, I mean, it can't be a quick fix.
It's
It has to be the whole body. But in terms of you know localized treatments like what we're talking about. So there's certainly going to be a role in general wellness and potential longevity and things like that. And that's being done and it's being looked at, and that's also exciting. And where we're also talking about localized treatments, I think that's at this state in the game, uh, for neck pain, for back pain, these treatments can work locally to help heal certain, just specific structures in the neck and back and help alleviate those ailments in a more natural way. So the field's very exciting, and we'll see where it takes us in the next 20, 40 years.
oh yeah,
It's only gonna be becoming more and more involved with medicine. As I said, we're doing some stem cell injections now in the spine, and of course, a lot of people are doing them in their offices for joint pain and things like that. So, and for overall wellness and longevity, and as there's more anecdotal evidence that comes out, where they show, and potentially if they ever do a study on it, then it it will become more mainstream. Just it's a matter of when.
100%. Tell us a little bit about your clinic. What are a lot of the things that you offer in your clinic and how that works and the type of people that you normally see?
Sure. Well, neck and back pain are the majority of things that I see, and joint pain, shoulders and knees. And right now, the regenerative aspect of my practice is low, in the sense that, as we said, insurances aren't necessarily covering it, and that sort of thing. And I treat a lot of disc herniations in the neck and back, and as I said, other ailments, and a lot of it has to do with different tools of my practice. So, as we were talking about before, that if someone comes in and they have a disc herniation, there's a whole process that we go through to figure out, okay, is it that herniated disc that's really causing the pain, or is it a different structure in their back? If they haven't, we send them out for conservative treatments. uh, Eventually, they might get an MRI, and and then we proceed on an algorithmic process to diagnose the problem. And these involve different kind of treatments, injections to focus on one or the other specific structures. We like to call it the pain generator. We find the pain generator, where's the pain coming from,
Mhm.
and then knock it out. And I've been fortunate, been pretty successful with my patients to help alleviate the condition.
That's
So
awesome. I love that. So let's just pretend that I am a soon to be patient and I come to your office. How would that look like? What are the steps? Do you see me for talk to me for 5, 10 minutes, or how does that work? I mean, what's the process of coming into your
sure.
office?
Well, digital consultation can be longer, 20, 30 minutes. Um, we go through the history of the pain, how long you've had it, where's it located, exacerbating factors, um, what position causes it, and was there any kind of accident or just repetitive injury.
Right.
And if you've already gone, many patients that have come to my office have already had the pain for a while, 3 to 6 months or even longer. and many have already had MRI studies. So we go over MRI studies, and again, uh, you have to take the MRI with a little grain of salt. So you look at the MRI, and people come in, and I also like don't I also don't like giving patients an untreatable diagnosis. So patients come in and say, I have disc degeneration, or I have arthritis in my spine. And I think to myself, well, what does that really mean?
Mhm.
Someone there was an article in the Wall Street Journal, I think it was last month, that said that doctors are not good communicators, and we use all these. I could send you the article if you want.
Interesting, very
I'd have to
interesting.
I'd have to find it. That sometimes they're I don't know. They use a few examples where they're giving someone a bad diagnosis or something like that, and what I usually do is I say to patients, I say, well, this is what the MRI showed. Everyone has this, and we just have to go through a systematic process to figure out, okay, is that really where the pain is coming from? Is that really the cause? And what do we have to do to treat it? And 99% of patients will get better with these conservative treatments and interventional treatments. And like you mentioned, surgery on your back that was recommended. And every once in a while, I say to patients, we did everything possible, um, but we need to send you to
Right.
more of a spine surgeon specialist. But most patients we can treat them without it. Um, there are a lot of back surgery being done these days, and I think sometimes not for the right indications. And so we do our best to help avoid that. And fortunately, we're successful most of the time.
That's awesome. I'm excited to see where just regenerative medicine is going to be because I know that we've barely even scratched the surface. And of course, new modalities that are coming out. You mentioned shockwave. I love shockwave. I remember my back was kind of giving me a hard time about 5 years ago. And it was about 4 years ago. And I was kind of getting some numbness, a little bit, you know, inflammation. And within like 4 minutes, went away. And it's never come back.
Right.
It's so interesting for the viewers out there so they know like what is shockwave and what does it do? That's since you do have it in your clinic.
Yes. Well, shockwave sends electrical signals into that specific body structure. And again, it's a non-invasive way of inducing the body's own healing mechanisms. It's supposed to actually activate patients' own healing cells and stem cells into the area, to track cells into the area to induce the body's own healing mechanisms to help repair that injury. So yeah, it's a minimally invasive treatment that we've been using, and we've had great results. I had a uh, patient recently that had a ton of pain in her shoulder, and she came back, and it was gone. So it's been miraculous.
No, definitely. I wish I owned one. They're
You
they're
can get one.
pretty they're a pretty penny, man. I mean, you know, there are other ways, but that's another podcast. Uh,
It's
yeah,
not
so
expensive. You go for a treatment, it's like
oh no,
$150.
what I'm saying is the
Yeah.
the treatment is affordable. But what I'm saying is I wish I owned Shockwave in my house, in my home. It's that great, meaning I love that system. I mean, especially for people, it's my opinion, of course. So, especially for people that I've seen that have like struggled with diabetes and inflammation, I know that a lot of them love that. I've seen a lot of people get better when they're in pain. So, I'm not telling you that, hey, that's what it's for, but I've seen people, they've gotten better by utilizing shockwave. Are there Do you see something like shockwave also maybe advancing maybe into doctors' offices, or are they already like I'm talking bigger box hospitals? Because I know they're in
Um,
doctors' offices, but in hospitals.
I don't think I don't see how hospitals would do it, but there are a lot of networks now that doctors are under hospital umbrellas, but it's being done more in the out in the community, and a lot of chiropractors and physical therapy offices have it as a conservative modality. You know,
Right.
so at this point, it's getting a little mainstream, but it's still
Yes.
on the unconventional side of things. So at least for now, I see it staying in that genre.
I just want to say, Dr. Todd, you're a blessing. Thank you so much for being here. And if you can leave a message before we leave to people that are on, let's just say if they've given up, no one can help me with my neck. No one can help me with this or that. I've tried every person and it just seems like I'm still in pain. What is something that you can maybe give some encouragement?
Well, if you've tried conservative treatment and some medications, some anti-inflammatories, you haven't gotten better. Um, you should seek care from a interventional pain specialist. These some people are a little resistant to having injections in their neck or back, but it's minimally invasive. Most of the time, there's very little negative effects that can happen with it, and they can be highly beneficial for these conditions.
Thank you so much, Dr. Todd, MD, for speaking on this subject. And I'm excited to get this information out to the public because just people knowing the role of regenerative medicine for neck and back pain and joints. As we get older, we need people like you. And so I want to tell people out there, don't give up, always have hope, and always speak life over your body. If you say you can't, you can't. I believe that the body and the spine was meant to heal, but you have to have the right modalities. You have to have the right people that are focused on that. So if you're looking for to get out of pain, to feel better, please see Dr. Todd. You can find him at gspweb.com. gspweb.com. And thank you so much, doctor. I appreciate you and I appreciate your time and your passion.
Mark, thank you so much for having me. It's exciting. I'm looking forward to the next 20 years of practice. It's
Hey, maybe 30.
really just if you don't mind my saying gspmweb.com. GSPM.
GSP. Okay. Well, just like the man said. All right. Thank